Dimpling in breast is involvement of what structure? Do it show skin involvement in malignancy? It's due to involvement of ligament of Cooper in malignancy, not a sign of skin involved. Retractation of nipple types. Slit-like in duct ectasia. Circumferential cancer, not a sign of skin involvement. PDO (POD orange) appearance shows involvement of subdermal superficial lymphatics in cancer. If more than 1/3 road of breast involved, it shows inflammatory breast cancer. Which lane are present between pectoralis major and minor? Rotter's lymph node. Functional unit of breast. TDLU terminal duct lobular unit. Most cancers arise here. How's the assessment of a breast lump done? Triple assessment. 1. Clinical examination. 2. Radiological investigation mammography, USG, MRI. 3. Histopathological FNAC, biopsy. Best method of clinical examination of a breast lump. Dial clock method. Radiological investigation of a breast lump. If age less than 40 USG, age greater than 40 mammogram. Mammography not sensitive in age less than 40 because both lesion and normal glandular tissue are hyperintense. What's BIRADS? BIRADS stands for Breast Imaging Reporting and Data System. It's used to categorize breast radiological findings into categories. BIRADS score, category and management. 0 needs additional imaging, do it again. 1 negative, routine screen in 1 year. 2 benign, routine screen in 1 year. 3 probably benign follow-up in 6 months. 4 suspicious, biopsy. 5 high SO malignancy, biopsy. 6 biopsy proven, surgical excision. Likelihood of cancer in various BIRADS scoring. BIRADS 1, 2 to 0%. BIRADS 3 to 0 minus 2%. BIRADS 4 to 4A2 minus 10%. 4B10 minus 50%. 4C50 minus 95%. BIRADS 5 to 95%. BIRADS 6 to 100%. For a woman with average risk, yearly screening for breast cancer should begin at what age? 40 years. Formal risk assessment for breast cancer should be done at age greater than 25 years. Gale index. Which females do have higher than average risk of breast cancer and what screening guidelines for them? 1. Hereditary susceptible. 2. Prior chest wall radiation. For them annual MRI from 25 years. Plus 3D mammogram from 30 years. 3. Strong family history. 4. If lifetime risk greater than 20%, then 3D mammography from 35 years plus MRI. Mammography is WHT. Radiation used. Mammography is XRY of breast. 0.1 minus 0.2 CGY, low radiation exposure. CGY is centigrade. 1 radian equals 100 CGY. Views in mammography. Which is better in axilla is seen in 1. Craniocaudal. 2. Mediolateral oblique. Better in axilla also seen. Findings in mammography. 1. Benign lesion show macrocalcification. 2. Malignant lesion show microcalcification. 3. Normal lane look kidney-shaped. 4. Malignant lane look rounded cause they lose fatty hilum. Breast ultrasound advantages. 1. No radiation exposure. 2. Preferred in pregnancy. 3. Better in less than 40. 4. Can detect ductal lesion. 5. Best to differentiate solid versus cystic lesion. Findings in breast ultrasound. 1. Benign lesion appear wider than taller plus macrocalcification plus lane hilum preserved. 2. Malignant lesion appear taller than wider plus macrocalcification plus rounded lane. What's the ultrasound imaging of a breast implant rupture? If intracapsular, stepladder pattern. If extracapsular, snowstorm pattern. Indications for MRI of breast. 1. Its IOC in breast implants. 2. Its IOC to identify multifocal and multicentric lesion. 3. Screening tool in high-risk patients. 4. When USG is inconclusive for ductal lesion. 5. Sensitive for ductal carcinoma in situ. 6. Detects local scar recurrence after breast surgery. MRI finding for breast implants intracapsular rupture. Linguini sign. What's multicentric and multifocal lesions in breast? Multifocal means multiple lesion in same quadrant. Multicentric means multiple lesion in different quadrant. FNAC needle used in breast. 23-30G needle. Disadvantage of FNAC in breast. 1. High false negative. 2. Can't differentiate between in situ and invasive cancer. 3. Immunohistochemistry markers can't be assessed. PR, HER2 NOI, Key 67. Which type of incisional biopsy is IOC in breast lumps? Core needle biopsy, true cut biopsy. Core needle biopsy, needle size 14G. Which type of incisional biopsy is IOC in breast skin lesions and Paget's? Punch biopsy. Which type of incisional biopsy is used in scarless fibroadenoma surgery? VABB, vacuum-assisted breast biopsy. Which is the gold standard biopsy in breast cancer? Excisional biopsy, 100% chance of detection.